Good morning. Chairman Guthrie, Ranking Member Eshoo, members of the committee. Thank you for the opportunity to testify today. It is an honor to be with you. On behalf of Families USA, a leading national, nonpartisan voice for healthcare consumers, working to ensure the best health and healthcare are equally accessible and affordable to all, I want to thank you for this critical discussion, as well as Chair McMorris-Rodgers and Ranking Member Pallone for your collective leadership in advancing bipartisan solutions to improve healthcare affordability and price transparency. Today's hearing is urgently needed. Our healthcare system is in crisis, evidenced by a lack of affordability and poor quality. Every person in the United States should have high-quality healthcare that prevents illness, allows them to see a doctor when needed, and keeps their family healthy at a price they can afford. Yet high and rising healthcare costs are eroding the economic freedom of American families right before our eyes. We can't afford to retire when we want, send our children to college, or even meet basic needs like paying for rent or heat. Almost half of all Americans forego medical care due to the costs. A third say that the cost affects their ability to secure basic necessities like buying groceries. And over 40% of American adults, 100 million people, face medical debt. Rising healthcare costs are a critical problem for national and state governments and affect the economic vitality of middle class and working families by crippling the ability of working people to earn a living wage. As a nation, we spend more than $4 trillion per year on healthcare, yet our health is not better. Our moms and babies die at higher rates, and 250,000 people are killed by the healthcare system each year from medical errors, infections, and the like. Every American knows that we pay too much for the quality of healthcare that we get. This crisis is driven by a misalignment between the business interests of the healthcare sector and the health and financial security of our nation's families. Our system allows the healthcare sector to siphon money out of workers' paychecks and taxpayer pockets and into building C-suites of big healthcare corporations to increase healthcare prices. We reward building medical monopolies and price gouging instead of ensuring the health and well-being of our nation's families. Healthcare industry consolidation has eliminated competition and allowed monopolistic pricing to push our families to the brink of financial ruin. Nowhere is this clearer than when looking at the price of hospital care, which accounts for 30% of US healthcare spending. That's $1.4 trillion annually. Since 1990, hospital prices have increased 600%, and just since 2015, they've increased 31% nationally, growing 4 times faster than workers' paychecks. These prices are not only high, but they're irrational. An MRI at a single hospital in Boston, Massachusetts costs 5 times more just depending on the insurance carrier. Or take the average price of a knee replacement, which costs 3 times more in Sacramento, California than in Tucson, Arizona. These higher prices are passed on to families as annual increases in insurance premiums, abusive facility fees, and higher cost sharing, and become profit margins for large healthcare corporations. But it doesn't have to be this way. We know what's driving the crisis and how to fix it. The PATIENT Act, which this committee advanced in May 2023, and the Lower Cost, More Transparency Act, which this committee played a leading role in drafting and which passed the House of Representatives in an overwhelming bipartisan vote in December of 2023, would both make crucial progress by codifying and strengthening price transparency rules, expanding site-neutral payments, and advancing billing transparency, among other reforms. Congress has enormous public support to do this. Nearly 90% of voters want Congress to act to reduce hospital prices, including 95% of Biden voters and 85% of Trump voters. I'd like to finish my remarks with the story of Brittany Tesso and her son, Roman, from Aurora, Colorado. Roman's pediatrician referred him to a hospital to receive an evaluation for speech therapy. Because it was the height of the COVID-19 pandemic, the Tessos met with the panel specialists via video conference. They observed Roman speaking, playing, and eating. Later, Ms. Tesso received a $700 bill for the 1-hour video appointment. Then she received another bill for nearly $1,000. Thinking it was a mistake, Mrs. Tesso called the hospital. And despite the fact that the Tessos never stepped foot inside the hospital, she was told that the bill was a facility fee designed to cover the cost of being seen in a hospital-based setting. This is a national scandal. We urge this committee to continue working with your colleagues in the House and Senate to stand with the American people and enact legislation to stop pricing abuses driven by big healthcare corporations. I thank the committee for your time and your dedication to these issues and look forward to answering any questions.
Thank you for your testimony.